I became a nurse practitioner for a multitude of reasons. The first one was I was always the sick kid. I always was at the doctor's office, had a multitude of different healthcare problems. When I was in junior high, my grandfather was diagnosed with cancer, and watching what he went through spawned me to have a lot more interest in healthcare. And probably my biggest influence was my great aunt. She was one of the 4 nurses who ran the Nurse Army Corps during World War II and later went on to retire as an admiral. She was the director of nurse of the National Institute of Health. She was one of the founding women of the nursing profession to make it into a very much more professional role. She always told me that follow your dreams, do what you want to do, but be a pioneer. Nurse practitioners weren't as big when I first went back to school and graduated 10 years ago. And now the profession has grown tremendously, and I feel very proud to be a part of that, taking care of people at home where I live in the front lines. I feel that we have a very close-knit group. We work very much as a family, the office staff, the nursing staff, and the healthcare providers. That's a very important aspect of the job where you feel like you're a part of a team, part of a community. I really like being a nurse practitioner. As nurses, we tend to be a little more get to know you, sit down, talk to you, a little more comfortable with sitting and talking and with the things that happen when we sit and talk with our patients. I enjoy as a nurse that I have this role where I can do a lot more for people than just bandaging a wound. I'm able to heal them both physically and mentally. And to me, that's a big thing, what I like about my job as a nurse practitioner. As a nurse practitioner, I have found getting to know my patients very well, to the point that I'm invited to weddings, baptisms. I had a patient even yet this morning look at me and say, you know, I've never been in a doctor's office where somebody sat and listened to me talk about the horrible things that have happened in my day so far and let me sit and cry on their shoulder for 20 minutes. That's something that's very important to me, to be able to be there for my patients, to help them through whatever the problem is. Whether it be the emergency room call at 2 o'clock in the morning or the 5 o'clock p.m., I don't feel very good. Can I get in to see you quick before the day's over? That's a big part of what I enjoy about my role as a nurse practitioner. Patients coming to see me should expect probably a little bit different than the usual visit. I'm going to come into a room and I'm going to sit down and talk to you. I'm not going to come in with a stethoscope around my neck to listen to your lungs and hand you the prescription. I'm going to sit down and say, what else is going on? Because oftentimes that cold you have, or the cough, the sniffle, the sneeze, the allergies, there's something else behind it. And in order to get you feeling better, sometimes we have to dig a little bit deeper to find that on that first try. I'm very willing to go the extra mile for you. I take time with my patients, I listen to them, and I spend a lot of extra time with them. I make a lot of my own return phone calls to my patients just because I feel like it's that extra special little touch that makes me more personable and more the nurse practitioner that I am.